common amongst us. I'm very sure that if you take a poll right now and ask those who have ever self-medicated at one point or the other, or at least those who know, if you know someone who have done it, I'm sure all our hands will be up. So it's a real public health issue that should be talked about. In fact, in researching for this topic, I found that the prevalence of self-medication in Nigeria ranges between 50% to 89%. So for something that is that high, I believe that it is a very important topic, and it's something to at least to educate people on the cost of such a highly prevalent practice. And so for that reason, today we'll be having a topic around this. And the beautiful thing is that we have two wonderful speakers on this topic who would be doing justice to the topic of discussion today. The first speaker on my list is Dr. Ganiyat Oyeleke, and she'll be talking to us about how self-medication affects the liver. A brief bio on Dr. Oyeleke. Dr. Ganiyat Kikelomo Oyeleke is a consultant physician gastroenterologist and hepatologist based in Lagos, Nigeria. She currently practices at Gastrodem Clinic and also serves as a visiting consultant at St. Nicholas Hospital. Dr. Ganiyat graduated from the Medical School of the University of Ilorin in 1995 and was awarded the Internal Medicine Fellowship of the National Postgraduate Medical College of Nigeria in 2009. She worked as a consultant physician and gastroenterologist at General Hospital, Broad Street, Lagos, from 2010 to 2015. And from 2015 to March 2025, she served as a hepatopathologist and gastroenterologist at Lagos State University Teaching Hospital. So for those who don't know, hepatopathologist is, in layman terms, doctor that is specialized on the liver. Between 2019 and March 2025, she was also the director of the World Gastroenterology Organization, Lagos Training Center. Dr. Oyeleke has attended numerous local and international trainings, courses, and conferences. She has published papers and delivered presentations on liver and gastrointestinal disorders at various local and international scientific meetings. She's an examiner for the National Postgraduate Medical College of Nigeria. She's a fellow of the American College of Gastroenterology, and she holds membership with several professional bodies, including the Lagos State Health Research and Ethics Committee, the Society for Gastroenterology and Hepatology in Nigeria, the European Association for the Study of Liver, the American College of Physicians, the American Society for Gastrointestinal Endoscopy, and the American Academy of Hospice and Palliative Medicine. She previously served as a vice chair of the World Gastroenterology Organization Training Center Committee and is a member of the World Gastroenterology Organization Endoscopy and Train the Trainers Committee. She's also a director of the Viral Hepatitis Lagos Echo Clinic, an initiative that is focused on educating healthcare workers and communities about viral hepatitis, and is a mentor with the African Association of Future Gastroenterologists. So Dr. Oyeleke will be taking us on the topic today. She will be taking us on a part of this discussion today, which is how self-medication affects the liver. Please, before I bring her in, a few rules that we would observe. Please note that this webinar, first of all, is also live on YouTube. So please, you can also watch this live on YouTube as it's currently going. And also, while this program is going on, we would not accommodate questions, verbal questions, but you could drop your questions on the chat or on the Q&A. And at the end of the presentation, you will get your responses. So please, without wasting too much time, we can do an online round of applause for Dr. Oyeleke Ganiyat Kikelomo. Thank you very much.
Thank you very much for the kind introduction. Thank you to SynLab for inviting me for this very important topic. So good day, everyone. Again, as introduced, Dr. Ganiyat Oyeleke. So we'll just go straight to the topic. And the topic is how self-medication affects the liver. So before we start, it's always good to understand what the liver does and where the liver is located. I hope you can all hear me, please, before going ahead.
Yes.
Yes, Ma, we can hear you very well.
Thank you very much. So I was just saying that before we start, it's good to know what the liver is and what the liver does. What is the function of the liver? The liver is the largest solid organ in the body, and it is located at the right upper side of our tummy, protected by the right lower ribs. It has several functions. In fact, while I was preparing, I saw that it has over 500 functions. You won't believe that. And the main function is to maintain health. And it does that through different routes, by metabolism, detoxification, bioproduction, protein synthesis, nutrient storage, and so many others. So I'll take a few of them one by one. It plays a key role in metabolism. Metabolism is like converting what we eat into energy and the building blocks to give us strength, to keep us healthy. The liver helps to detoxify. When we detoxify, we're removing toxins, things that can harm the body. The liver detoxifies by processing medications that we use, by processing alcohol, for example, that can harm us. So it helps to detoxify it. And of the other substances that it helps to detoxify, to remove the toxin so that those toxins would not harm us. It also helps to produce bile. Bile is necessary for digestion. It helps to digest fats. It also helps to synthesize protein. Synthesis is like producing proteins. The special proteins that the liver produces helps in blood clots, helps in building the building blocks of the body, and helps to also defend the body, protecting and defending our immune system. The liver stores nutrients, and it can store nutrients in forms of energy like glycogen. It helps to store vitamins and can also store iron. We know, and I'm sure you might have heard, that the liver can regenerate itself. Regenerating means if a portion of the liver is bad, the liver can repair itself on its own. But we have to be careful when we want the liver to do this, to make sure that the liver has not been completely damaged, because a liver that is completely damaged cannot be able to regenerate. So this is why it's important to keep our liver healthy. If something that can regenerate, you still have to maintain it to a point. So I just found this picture this afternoon, and I saw that, I mean, this is the typical thing we see in some parts of the country. It is not peculiar to Nigeria, I must say. It happens even in other African countries, even abroad or in developed countries. So you could see that this is medications being hawked on the streets. Why does this happen? Are there no regulators to help to prevent all this? Is it that there is a need that must be met urgently that people cannot walk into pharmacies or walk into hospitals to get proper prescription and proper medication. Do we know where these medications are coming from? Are they real? Are they fake? Are they substandard? Are they relabeled drugs that have expired that are being used? Do they contain what they contain? These are the questions I feel now we should start to ask ourselves before we patronize these people. What am I putting in my mouth? Am I causing more harm to my body than what I'm supposedly treating this with this? Self-medication is very common in Nigeria. And the host to mention that during when he was preparing, he found up to over 50%, up to 85% Nigerians self-medicate. So why do we do that? Why do we self-medicate? Self-medication is common, sometimes due to socioeconomic factors, but sometimes people often treat ailments like headaches, cold, fever, without consulting healthcare professionals. And because we feel these are basic stuff. I don't need to go to the hospital because I have headache when I can take paracetamol, for example. People also self-medicate because they feel there's high medical costs. They go to the hospital, you first pay for registration, you pay for consultation, and there are times there's a long wait. I know, I mean, they talk about this a lot. The day you go to a hospital is like you don't have any other job for that day. Then there is easy access to over-the-counter medications. In Nigeria, there is nothing you cannot buy over the counter. Well, majority you can buy over the counter. So we need to work on this as well. Then the cultural beliefs as well. So we believe in traditional medicine. We believe that there's some herbs that can help us. Yes, herbs can help, but we have to be very cautious. So we're talking about why people self-medicate as well. Also, many rely on personal judgment or non-professional advice. If my sister had abdominal pain yesterday and she took something, then I can use that same medication as well. So these are reasons why people self-medicate. Which are the drugs that are easy to self-medicate with? The first one I put here are the painkillers, analgesics. And for this, we have the paracetamol group. They come there, they first. But there are other ones. It could be paracetamol, it could be some other groups which we call non-steroidal anti-inflammatory, including maybe ibuprofen, piroxicam, so many other drugs in that category. And why are they used? For headaches, for body pains, for joint pains. Elderly people have arthritis. You know, we need those pain medications. So those are the ones that are the most common. Then the next one here are the antibiotics. They are usually frequently purchased over the counter as well. I know that in some countries they've regulated use of antibiotics or purchasing antibiotics over the counter, but we're not there here yet. We get them without prescriptions. Sometimes you request for prescriptions for them. Herbal mixture. This is also very, very common. And I'm sure we all, at one time or the other, for different reasons, I'm Yoruba, so I hear people saying "Ọ̀pá karaole," you know, different kinds of mixtures available. These are things that people self-medicate on. Then now there's the growing, increasing use of supplements. Recently, I got to know that there are supplements for hair, for nails. There is supplement for everything right now. So we have to be very careful. They are consumed for weight loss. They are consumed for weight gain. They are consumed for muscle loss, for muscle gain, you know, so for different things. Supplement for the eyes. So it's important that we know when and how and avoid self-medication practices because these medications On their own, they can have direct effects on the liver. Together, they can have compounding effects on the liver. They can interact with each other and produce something that is bigger than what you expect. So it's important. What does excessive painkillers, for example, do to the liver? So I put this picture of, as simple as paracetamol is, that we feel, is it not just paracetamol? Overdose of paracetamol can lead to liver failure. Yes. If you overdose medication like paracetamol, it can cause liver failure. The liver can fail completely. And how do people overdose it? I mean, growing up, I had somebody that I knew then that he would tell me that taking 2 tablets of paracetamol would not help him. So he would rather take like 3 or 4 tablets. Accumulating these over the time is telling on the liver. And as you get to know, the liver is a very resilient organ. It does not really complain. By the time it starts to complain, it may be far too late. Other pain medications like the non-steroidal anti-inflammatory, like I mentioned, the ibuprofen, Daga, aspirin, can also cause liver stress and damage the liver over time. So over time will be chronic use. When you say chronic use, when it becomes a habit, something you take regularly, consistently. Now, combining these pain medications, so some people are in the habit of, if paracetamol alone cannot do it, I'll add paracetamol and add another, maybe cocodamol and add another one. Combining pain medication is also bad for the liver. And now combining this and adding alcohol increases liver toxicity. So it's very, very important that we know that these pain medications, when they are used at a high dose, when they are used consistently, when they are combined with alcohols and with other drugs, they can interact and increase toxicity to the liver. Unsupervised use exceeding the safe dosage limits. Like I said, there's some people that will feel, the 1 tablet will not be fine for me. I'd rather take 2 or 3. And of course, we know we have fake and even substandard drugs. People, I mean, I know that the regulatory authorities are trying, but we still have drugs that are supposedly expired that have been relabeled. We have even fake medications around. So these are substances that can cause damage to the liver. And what they cause is increasing the toxicity, causing liver injury, and resulting into liver failure, or gradually damaging the liver, resulting into further destruction. The next are the antibiotics. Antibiotics they are very good medications that are used for bacterial infection. They can also harm the liver if used without guidance. They can cause what you call drug-induced liver injury, which is DILI, incorrect doses or use of non-bacterial infection. Some people are in the habit of, I had fever, I used anti-malaria, I did not go, so it must be something else. Then I should, after anti-malaria, then you have to use antibiotics with it. These antibiotics are strong drugs. They're strong drugs. They can cause damage to the liver if they become like a habit. And like I said, in addition to even causing damage to the liver, you can also develop antibiotic resistance, which is another big issue that, which is beyond the scope of this discussion. So it's important that we know that whenever we need to use antibiotics, particularly strong antibiotics, you need to get a proper prescription, use the proper dosage, because incorrect dosing is also a big problem. Be sure that it is used for what you want it for, because there are times you have fever that is persistent. It may not be an infection from bacteria. It could just be a viral infection. At a case, for example, if you have like cough and catarrh, and for most people, it's just a viral infection that will run its course. It is not everything that we throw antibiotics at. And the symptoms of liver disease could be jaundice and fatigue, but we know that as we always say, that most times we do not want to wait until those symptoms start, because it may be too late when the symptom starts to actually revive the liver. Unsupervised use of these antibiotics can cause resistance, complicating future treatment. Now, the ones that are we should talk about a lot, the herbal effect on the liver. I know that as a hepatologist, whenever they mention herbs, I think it's always a tug of war with people at times, because we are always very worried. Herb mixtures are good when you know what is inside. Herbal mixtures often contain unregulated active compounds. And what I always tell people with this is, what are you mixing together? It's important to know the components. It is important to know the dosage. It's important to know, when you know the components, then you know when they can interact with another medication. Because most of all the tablets we're talking about, they're also probably prepared from, some of them prepared from some herbal mixtures. So this is not to completely say herbs are bad or they are unsafe, but it is important to know the components, to know that they contain compounds that are regulated. The potential for liver injury is usually due to the unknown ingredients, unmeasured dosages. Supplements may include undisclosed conventional drugs, which is another thing. Sometimes I've had stories of some people preparing herbal mixture and even adding conventional drugs to it without you knowing. So it's important to know the components of what we're taking. So we're discussing now drugs, herbs that are prepared at home, but we know now that we also now have herbs in capsules. So for this, we must know that prolonged use of unconventional, undisclosed, conventional drugs can lead to liver stress and liver damage. And you can see the pictures of like the low level. This is the liver, the normal liver. The next arrow is showing the liver that is under stress. You can see it has lost its smooth, shining appearance. It's becoming rough. If it progresses to drug-induced liver injury, then the progression, you can see it when it becomes really rough. We call that liver cirrhosis. We do not want to speak big grammar this afternoon so that we can understand that a normal liver would still function. The liver can continue to be diseased, but it will still be working without you knowing. If we want to wait until the symptoms occur, it may be too late by the time the symptoms appear in the liver. And severe damage is irreparable, which is the one we call liver cirrhosis. It is irreparable. Yes, the liver can regenerate, but it can regenerate when it is still, the appearance is still good and it has not become cirrhotic. So we've been talking about the drug-induced liver injury. This is a major health issue. And we know we've talked about how they happen: unsupervised medication, overdose of medication, unconventional drugs, fake medication, substandard. Sometimes even what they use to mix this medication may be, the adulterants are the issue and the culprits. The liver, which metabolizes drugs, can be damaged by excessive or inappropriate dosages. And over-the-counter painkillers, even paracetamol in high doses, can result into liver failure. So it's important that we're careful about this. Another issue is polypharmacy. There was a time I asked one of my patients to bring all the drugs the elderly man was using, and they brought everything in a traveling bag. And the man said, oh, my son from America sent this, my daughter from US sent this, my cousin from, so, and in a bid to want to make sure that it captures all the things that the different family members have sent, he was repeating the same medications over and over that was causing more issues for him. So polypharmacy and taking multiple drugs can also result into drug-induced liver injury. And like I said, we do not want to wait for symptoms of jaundice and fatigue and pain. We need to start and do something early. So now we know that with rising burden of fatty liver occurs when you have more fat deposited in the liver than it should be. The new term medically is now called the metabolic dysfunction associated steatotic liver disease. But I think for this discussion, we'll just call it fatty liver. So why do people have fatty liver, for example? Fatty liver in Nigeria now, aside alcohol, which is a common cause, could also be due to poor diets, inactivity, obesity, high cholesterol levels, and certain medications can result into that. So if you have fatty liver as a background, then you now have medications that can also potentially cause liver damage. You are aggravating damage to the liver. So they can result into inflammation in the liver, which we call hepatitis, but this one is the inflammation from other causes except other than the viruses, and scarring in the liver. We also know that we have a high burden of viral hepatitis B in Nigeria, for example. As the most recent survey, we have about 9 to 10% prevalence of viral hepatitis B in Nigeria. Viral hepatitis on its own can cause liver disease and can progress to liver cirrhosis and even liver cancer. So we need to be mindful of all this before you start to put on medications that can potentially cause more damage. So we've talked about fatty liver, poor diets, because now we're eating like the Western people, eating all the burgers and refined carbohydrates. So it's important to maintain a healthy diet, to avoid being sedentary. So exercise regularly, be careful with all the type of food that is too calorie dense food, manage being overweight and obesity. And for people that have diabetes and insulin resistance, this is also a very it's a common consequence of diabetes. So it's important that we maintain a good health. For those that have diabetes, they maintain a good level of the glucose regularly. Public health efforts on lifestyle changes and vaccination are very, very crucial, as we've said. So people often ask, how will I know when I have liver damage? And, the summary is most times we do not want to wait for these symptoms to occur, because most times at the early stage, there are no symptoms. You will not feel anything. But if you start to have fatigue, or the white part of the eyes become yellow, which we call jaundice, or the urine starts to become darker or more deeper yellow than it should, or the stool becomes pale, there's loss of appetite, there's feeling like throwing up, nausea, the abdomen starts to swell, we worry that there may be damage to the liver. Like I said, it's important to seek help early. And if you know in the past, you've taken too many medications, then you may need to run some tests. These tests are the tests that we can do early that will give us what is happening earlier before the signs of liver damage becomes apparent. So the investigations, the first thing is we want to do a liver chemistry and liver function test. From there, other tests may be necessary depending on what you find. I think the second speaker is going to lay more emphasis on the investigations, but you can also do an ultrasound. There are so many other tests that we can do to access what is happening, depending on the situation. But the easy one would be, let's do a liver chemistry and liver function just to know what is happening. So what are the actions to take to protect the liver? Please limit self-medication. Again, limit self-medication. Yes, I mean, if it's Panadol for headache once in a while, but not a habit. Consult a healthcare provider before taking medications, particularly for those that have other medical conditions. So if you have diabetes, if you have high blood pressure, hypertension, if you have fatty liver, or if you have hepatitis, or some other conditions, maybe peptic ulcer and all that, we have to be very, very careful. And generally, I think it's even a good advice for all of us to limit self-medication. The second approach is to avoid excessive alcohol consumption, to minimize or stop smoking, and to also avoid excessive herbal medications. For herbal medications, please only drink what you know you put inside. Very, very important. And discuss with your doctor if it is okay to, if you insist on taking that, because sometimes when we say, oh, don't take herbal drugs, people will like, this is what my grandfather did and nothing happened to them. But it's important that we put everything into perspectives, please. We want to reduce the strain on the liver. Then maintain a balanced diet rich in fruits, vegetables, and whole grains. So it's very, very important. Diet is the ultimate. Eat regular Nigerian food. Avoid too much of all these burger and this and noodles and that and that. So we need to make sure we go back to our roots. Fruits, vegetables, and whole grains. Exercise regularly, please. Very, very important. Prevent obesity, prevent fatty liver. Exercise is very, very vital and is about the single most important after diet. Very important. For those that haven't received vaccination for hepatitis, please protect your liver health. Get the vaccination. But to do the vaccination, you have to check that you do not have hepatitis B. So again, there are some blood tests, blood work that you need to do just to know. Then the role of regulatory authorities is very important. At the end of the day, we can't do this by ourselves. The medical healthcare workers, pharmacists, doctors, the regulators. In Nigeria, we have NAFDAC, the Ministry of Health. I think we need to still make so much noise, I would say, about this so that the innocent public will not be exposed unnecessarily to damage. Somebody mentioned just a few days ago that why is it that there is increasing rates of kidney disease and liver disease? And I said, I think majority of what is going on is it has to do with what we put in our mouth. So we need to be very, very careful. So the medications, self-medicating, we need to be very, very careful. Please consult a healthcare provider before taking medications. This is where I end my presentation. Thank you for your attention. And I think I welcome questions on the chat for now. Thank you.
Thank you very much, Dr. Ganiyat. That was a wonderful presentation. You have indeed touched a lot of aspects surrounding this very important topic. Just a little recap. Dr. Ganiyat touched on the functions of the liver. She also talked on the reasons of self-medication. For most of us, it's about convenience, it's about the quickness with which we can access medication. And then she talked about the common self-medicated drugs, the painkillers, the antibiotics, as well as the damages that it causes to the liver. But very importantly, she also touched on the steps to take in protecting your liver, some of which are limiting your self-medication, which is a topic we're handling today, She also talked about avoiding excess alcohol and smoking. And then if you're going to take herbal drugs, you should make sure you know what is in it, and also to contact your doctor when necessary. She talked about maintaining balanced diet, exercising, as well as getting vaccination for hepatitis. So it's really been a wonderful presentation, Dr. Ganiyat. Thank you very much. And for those who have posted questions in the chat box, please know that your questions are being seen. So we would take a few questions now before we bring in the next presenter for our presentation. Okay, so thank you for those who have dropped questions in the chat box. I will be taking the question from... Okay, so we'll take the second presentation first, just so the flow is, just so that the flow is smooth. We'll take the second presentation, after which we'll take all the questions together. So please keep dropping your questions, and at the end of the presentation, we'll take everything together. All right, so the second presenter today is Dr. Omoyele. Dr. Omoyele, please let me do the honors of introducing you.
All right, thank you.
Okay, so a brief bio on Dr. Omoyele. Dr. Olusola Omoyele, who happens to be my colleague, is a consultant chemical pathologist at Synlab Nigeria Limited. She has a deep commitment to advancing patient safety in laboratory medicine. She earned a medical degree from Obafemi Awolowo University and holds a master's degree in clinical pathology from the University of Lagos. She is also a fellow of the West African College of Physicians, Laboratory Medicine. Dr. Omoyele brings extensive expertise in clinical diagnostics and quality assurance. And I must say this at this point, that I have experienced this myself. Her passion for safe and accurate laboratory practices drives her contribution to improved patient outcomes. So please join me and give us an online round of applause as we welcome Dr. Olusola Omoyele. Thank you very much.
Okay, thank you, Kelechi, for the introduction. Good afternoon, everyone. I'm glad to be here. Thank you for joining. So today I'll be discussing the liver. And thank you, Dr. Oyeleke, for the beautiful presentation. It was truly enlightening. So I'll start by saying that liver diseases are often described as being silent, because many individuals with existing liver disease do not have symptoms at the early stages. And many of these diseases that she mentioned are treatable if they are detected early. And crucial in ensuring that the health of the liver is protected. Just trying to... Okay, yes. I think it's the network page. Please confirm that you can see my second, the second slide on why the liver matters.
Yes, we can.
Okay, so the healthy liver is essential for overall... All right, thank you. So the healthy liver is essential for overall health and survival. Dr. Oyeleke discussed the various functions of the liver. So I have a few of them listed here. And so it is important that existing problems are detected before the symptoms appear, because in most cases, by the time too late, and the output may not be so good by then. So these are some of the things that C and alcohol-related liver disease, and also those liver injury that is due to medications. So I have a case illustration here just to emphasize the role of preventive testing in early diagnosis of liver diseases. This is about a 60-year-old man who feels perfectly healthy, is able to carry out his activities, no pains, no symptoms. And so he had routine screening, which reveals elevated ALT. ALT is one of the parameters in the liver function test that is usually done. And this was found to be much higher than what should be found in healthy individuals. And when he had an abdominal ultrasound, it was found to have a fatty liver. So he was seen by his physician, placed on lifestyle modifications, and this prevented the progression of the fatty liver to cirrhosis. So if he had not had this test, this man would have assumed that all was fine, that all his organs were fine. And if he had continued with the lifestyle, with the diet, with the kind of diet he was taking, then the fatty liver would probably have progressed to the late stages. So who should prioritize liver screening? We have been informed about the high risk group. So the high risk group are people that are likely that may have liver diseases. So people that self-medicate. There was a lot of emphasis on self-medication, and when Dr. Oyeleke had the presentation, and she also talked about those who use herbal remedies regularly. Individuals who consume alcohol excessively, those who are overweight or obese, those who live with diabetes, have high cholesterol, have chronic hepatitis B or C infection, and those with family history of liver disease, or take long-term medications. So it's important for everyone to have screening, but for these individuals, it's particularly important, and they need to prioritize this liver screening. So what are these screening tests? I would describe it as the low-hanging fruit. They are very basic investigations that can be done and could just give an idea of what is happening in the liver. So we have the liver function test, and then the screening for hepatitis B and C. So this would help to know the status, and then help make informed decision on the need for vaccination if one is negative, and then if one is positive, to see a physician who would then assess one for maybe possible complications or the liver health and what needs to be done. And then another screening test that usually done along with the blood test is the ultrasound scan of the liver. A liver scan is able to pick fatty liver even before the liver function test are deranged, and then it can pick fibrosis. Fibrosis is a disruption in the normal arrangement of the liver tissue, and then it can also pick up liver masses when present. So I want to talk about the liver function test. I'm sure a number of us have heard about liver function test, what they mean, and why would one need to do a liver function test. So a liver function test is a group of tests that is used to assess liver health. And so these are the parameters that are usually done in the liver function test. So I mean, when the report should have these parameters. So I'll talk about the alanine aminotransferase. So it is an enzyme that is present in the liver. What I mean by enzyme is like a protein that helps particular steps in those functions that the liver carries out. So the alanine transaminase is supposed to be present mainly within the liver cells, and just a little amount of it should be found in the blood. However, if there is an injury to the liver, what I mean by injury is anything that could disrupt how the liver cells, the integrity of those liver cells. So it could be from an infection like hepatitis. It could be from medications like maybe high doses of some medications, or herbal medication. So if there's anything that affects the integrity of those liver cells, the alanine transaminase enzyme is released in large quantity into the blood. So we can take a blood sample and quantify the alanine transaminase. So if you see elevated level of alanine transaminase in the blood, then it indicates that there is an injury. And the good thing about this ALT is that it is produced exclusively, is found exclusively in the liver. So when we see high ALT, we know it is coming from the liver. And so a high ALT would then prompt the physician to further investigate what could be happening to the liver. So the next one is AST, the aspartate transaminase. So it is also an enzyme that is in the liver, but unlike ALT, AST is also found in some other tissues in the body. So we have AST in the liver, in the red blood cells, and the muscles. So if one does a liver function test and you're seeing AST that is elevated, one will not be able to conclude that it's really from the liver. So we have to consider the other tissue sources of AST. And then for alkaline phosphatase, that is ALP, it has to do with the bile duct, the integrity of the bile duct. So high levels of ALP are usually found when there is obstruction. But a limitation to the use of ALP to know if there's some obstruction in those ducts, those tube-like tissue that carry bile from the liver, is that the ALP is also found in some other tissues. So the alkaline phosphatase is also found in the bone, it's found in the intestine, and then in pregnant women in the placenta. So if we are seeing high ALP, we may need to investigate further. Is this we need to know the tissue origin. So for instance, if an individual has a persistently high ALP and other liver parameters are fine, the ultrasound scan shows that the liver is fine. There's another test that could be done to identify the tissue origin. So isoenzyme. So that would indicate what particular tissue the alkaline phosphatase is coming from. And then the next parameter in the liver function test is the GGT, the gamma glutamine transferase. This is usually used along with the ALP for obstruction. But a very common cause of high GGT is excessive use of alcohol. So from looking at the liver function tests of those who consume alcohol, one can know that one can actually find effects of alcohol consumption by mere looking at a liver function test. So alcohol consumption, excessive consumption of alcohol, can cause some raised GGT. And also if there's obstruction, you can have raised GGT along with alkaline phosphatase. Another parameter is bilirubin. There are quite a number of things that can cause raised bilirubin. Bilirubin, for instance, in babies can have high bilirubin, and it doesn't mean there's a liver disease. So it could be bilirubin could be high if the body is breaking down too many red blood cells, and so we have a lot of bilirubin being formed. Or it could be high if there's an obstruction to the flow of bile out of the liver. So albumin, the liver produces so many proteins. And so just a few of these proteins are used to check if the liver is producing those proteins as it should. So one of the proteins that is usually checked as part of the liver function test to know if the liver is producing the proteins in adequate quantities is the albumin level. So albumin level, a low albumin level, in the early stages of liver diseases, albumin level is usually still within the normal levels that you see in healthy individuals. But in late stages, the albumin level may be low. But then I would like to state that it's important to interpret this in clinical context, because there are several other conditions that can cause a low albumin level that do not indicate that there is a primary liver disease. And so same with the PT, what we call the pre-protein time, to check the ability of the liver to produce clotting factors as part of the protein. And then we have the total protein. That's just the amount of total protein that is in the blood as part of the liver function test. So what are those complications that can be prevented by screening, by having this screening test? So we can prevent the late stages, that's liver cirrhosis, when there's a disruption in the arrangement of the tissue, of the liver tissue. We can prevent liver failure and liver cancer. For instance, if an individual has hepatitis and is detected early, it can be managed and monitored by a physician to ensure that it does not progress to liver cancer. So early detection creates opportunities for intervention before the irreversible damage occurs. So I've talked about the screening tests that are used by physicians to confirm some diagnoses, to determine the prognosis, and then to monitor patients that are being treated for some of these liver diseases. So for instance, in hepatitis, for patients with viral hepatitis, there is the hepatitis B panel that is available, the hepatitis B surface antigen, antibody, E antigen, E antibody. So the gastroenterologists are familiar with these tests, and so they use them to monitor their patients. And so there is also the hepatitis B virus DNA quantification. So this checks the number of copies of the virus that are in circulation to know if the virus is the load is high, is what is commonly called the viral load. So if it's a high load or it is low, a low load. So this use of hepatitis C, there's the anti-HCV that is used to check if the person has, that's the antibody to the hepatitis C virus to determine if there is the infection, and then the RNA, which also checks the number of viral copies. And the clinicians also request for the liver function tests to monitor the progress of these individuals. And then another test that is done by clinicians is maybe the FibroScan and then the fibrosis score to check for fibrosis and cirrhosis. So the clinicians are interested in knowing what is happening if there's disruption in the liver study. So that is a scan. It checks the architecture of the liver. While the fibrosis score is a calculated parameter. So it's calculated from the ALT, the AST, and the platelet count of the individual. So we calculate it and then know we call it 5-4 index. So it's so those that have the high levels, the high score indicates the high risk of having fibrosis. And then what is also done by our clinicians is surveillance for hepatocellular carcinoma. That is liver cancer, the cancer that is arising from the liver itself. So the clinicians use, it's recommended that they should have an ultrasound, and then this can be done along with alpha-fetoprotein. Alpha-fetoprotein is a laboratory test that can be done. And so it's in adults, the levels are usually expected to be low. But if there is a cancer, the levels gradually rise. So if the AFP level is serially monitored, they can pick the development of cancer quite early in these individuals. So these are the key messages. That liver disease often develops silently with no symptoms at the very early stages. That self-medication and herbal mixtures can contribute significantly to liver injury. The liver function test can detect problems before the symptoms appear, so it is important that we have this test to detect whatever is going on. And then the high-risk individuals that were listed earlier should undergo regular screening. That early diagnosis improves outcome and reduces the costs. And that preventive testing is one of the best investments in long-term health when we consider the time that could be wasted, and then even the amount that one needs to spend on whatever complications arise in the late stages. So I'll say this, that a normal liver function, liver function test may not exclude your liver disease. So it is possible to have a liver function test or report, and all parameters are within the normal levels expected for healthy individuals, and a liver disease is ongoing, maybe at the early stage. It is therefore important that all laboratory results are interpreted in conjunction with the clinical findings and, where appropriate, imaging studies. Thank you very much for your attention.
Thank you very much, Dr. Omoyele, for your wonderful presentation. Dr. Omoyele just presented on the subtopic protecting liver health through preventive testing. And just a little recap, there's something that really caught me, which was at the beginning of the presentation, where you talked about those who should prioritize liver screening. And I would like to just repeat that slide because I believe that's very much beneficial, especially to all of us here. So for those who frequently self-medicate, for those who use herbal remedies regularly, those who consume alcohol excessively, those that are overweight or obese, those that have diabetes, those with high cholesterol, those with hepatitis B or C infection, those with family history of liver diseases, and those that are on long-term medications. These are people who should prioritize it. Of course, like she mentioned, it's important for everybody to regularly check for their liver function, but these are people who should prioritize it most especially. And then she also talked about the type of liver test to do, which is the LFT, PTINR, albumin, and co. She talked about the complications that the liver test can prevent. And then examples were cirrhosis, liver failure, and liver cancer. She also mentioned the tests that are done for viral hepatitis, which is the viral load, the hepatitis test itself. Talked about assessments of fibrosis and cirrhosis, and then, of course, how to check for cancer, how to check for liver carcinomas. Thank you very much, Dr. Omoyele. That was truly a wonderful presentation, and I believe we all benefited from it. Okay, so we will be moving over to the next session, but before we do, I would like to also mention that for the test that Dr. Omoyele mentioned, those tests can be ordered from the comfort of your home, from the SynLab website, which the link will be pasted on the chat box. Please look out for the link on the chat box. But it's simple, it's www.synlabnigeria.com, synlabng.com. You can order your test from, synlab.com.ng. You can order your test from the SynLab's website. Okay, moving on to the next session. Again, before I continue, it's important to note that this session is also live on YouTube, so please feel free to subscribe. You can also follow us on all our social media platform. The handle is SynLabNG on YouTube, Facebook, Instagram, and TikTok. SynLab is available there, so please do subscribe, do like, share, and follow our pages. All right, so we move to the question and answer session. And I will begin with the questions in the chat box. I'll be taking them in the order in which they were asked. So please bear with me as I sort these questions out. Okay. Okay, so the very first question I'm seeing here is from, sorry. Questions keep changing. Okay, so pharmacist Lukman is asking, fatty liver, what can someone use to treat it? I don't know if that question is clear enough.
Yes, it's fine.
Okay, thank you.
Okay, so thank you, pharmacist Lukman, for this question. So fatty liver means there's accumulation of fat more than what we expect, and it can be graded in different grades. But what can one use? What you use will depend on what is causing it. Fatty liver can be caused by alcohol. Fatty liver can be caused by excessive weight, like obesity. It can be caused by diabetes. It can be caused by high cholesterol. So it depends on what you have. If you take alcohol, the first step is stop alcohol, please. The next one is to find out, do you have diabetes or high cholesterol? So you run the test that SynLab has brought forward. So you do the test. If there's diabetes, you have to manage it. If the cholesterol is high, you have to manage it. The next one is now managing it would involve lifestyle adjustments a lot. If there's weight, if you know that, oh, I've added like maybe 10 kg more than usual, then it will now start with weight reduction, diet, healthy weight reduction, please, I must say. Aggressive weight reduction is even bad for the liver. So, but you do weight reduction using diet and lifestyle and exercise, then you can now manage other conditions, like you said. So I hope that answers the question.
Okay, thank you very much, so Ganiyat. The second question is from Abolade Abiola. Please pardon me if I don't include your titles. It's because it's not displaying, please. All protocols duly observed. And the question is it possible for someone to have liver disease and not have viral hepatitis?
Thank you very much. I get to ask that question a lot, and that's because in our environment, viral hepatitis is the most common cause. Yes, you can have liver disease without having viral hepatitis. Viral hepatitis is just one cause. You've just heard us talk about fatty liver, for example. So you can have fatty liver. You can also have liver cysts. You can have liver abscess. There can be, so there are all kinds of other liver diseases. There is autoimmune liver condition that is not viral hepatitis. So yes, the answer is yes, you can have liver disease without viral hepatitis. Viral hepatitis is just one cause. Thank you.
Okay, thank you again, Dr. Oyeleke. There's a second question from him that also asks, and can drug like Mounjaro or Ozempic be taken for fatty liver?
Okay, so yeah, we're moving to some interesting aspects of medicine now. So Mounjaro, Ozempic are drugs that were designed for diabetes, but they are also now known, they are now the drugs for weight loss. They are the new babies for weight reduction. So usually for fatty liver, we do not necessarily encourage the rapid weight loss medication. We encourage you to use something that is sustainable, that it's not adding an extra chemical into the body. However, some people, maybe they've tried other forms of weight loss, diet, exercise, and that is not working. But I wouldn't prescribe Mounjaro or Ozempic just because of fatty liver. I would rather the person uses diet, exercise, and other lifestyle methods to try first. But if you've tried several other ones and it's not working, then you have to be properly reviewed before we start you on those other medications that are now the in thing for weight loss. So that would not be my first line of managing fatty liver. Thank you. You're muted, Mr. Kelechi.
Thank you very much. So I go to the Q&A box, deviating away from the chat box now. And Helen Dulo is asking, please, what is the best cure for hepatitis B?
Helen, thank you for that question. At the moment, we can only manage hepatitis B. We cannot cure hepatitis B. We can manage it like we manage diabetes and manage high blood pressure. There are medications that have proven to be very, very effective and safe for hepatitis B and would prevent the complications which we dread, like liver cirrhosis and liver cancer. There is no drug right now that cures hepatitis B. And also, please, I'm using this also to address, because you see all kinds of things on social media about a certain herbs that can cure hepatitis B in 2 months and all. We do not have a cure for hepatitis B at this time. The drugs available can only manage the condition. So that is the best we have for now. Thank you. And they're very effective and they're safe as well.
Okay. So M. Diary is asking, can I take NAFDAC approved herbal mixtures without anything to worry about?
I wish I have someone from NAFDAC here to answer this, or a pharmacist. The fact that there is NAFDAC approval does not, I don't think that means that it's completely safe. So I think we need to be very careful. So I don't know to what extent the approval and all that, but I think one should still be very careful. The important thing for me with herbal remedies will be, the first thing is you must know the content of what you're using. You know, so when people bring herbs to me, I ask them, let's know what is inside. Because, I mean, some people call spinach herbs, for example, which is just a efo that we eat. You know, they call bitter leaf herbs. You know, so for me, I say, is it herbs? What is it with scent leaves? Then we know that it's just vegetable. If it's cucumber water, I know it's just vegetable. But the ones I don't know are when it becomes complex of roots that are mixed with alcohol, which is another thing that happens. So sometimes the content is fine, but the way they prepare it is also another issue. So I won't be able to clearly discuss NAFDAC approval and all. I think the best is just still be very careful. Make sure you know the content, make sure you follow the regulation. And if you're not clear about it, please follow your instincts. Don't take it. That's my advice. I think you have
and
to
also speak to your doctor.
Speak to your doctor, yes.
Possible.
For sure.
Okay. All right. Someone asked, no name, but the person asked, can you explain the effects of gallstone on the liver?
So the gallbladder is right underneath the liver. And together, the liver, the gallbladder, the pancreas, it forms the hepatopancreatical biliary circulation, gallbladder, pancreas, and liver. When there's an obstruction in one, it can actually also lead to issues with the others in that same network. So there are times when you have like a stone blocking the passage of bile. Or yes, if there's a stone blocking, then it will also have like a backward effect in the liver. So if you have like an impacted gallstone, in some instances, depending on the location, it can cause like accumulation, a blockage within the liver, resulting into jaundice. We call that jaundice obstructive jaundice. So they are close, they have the same intrinsic network and circulation, and they can affect each other for sure, depending on the location of issue. So if it's a large stone that is impacted, it can also result into jaundice, for example, and obstruction within the liver.
Okay, thank you very much. Please, before we proceed, I also like to mention that there is a poll that has been launched. Please, we encourage everyone to take the poll. And also as a reminder that this is also being streamed live on YouTube, and you can subscribe to our YouTube channel, which is at Synlab NG. We're also available on Facebook, Instagram, Twitter, and TikTok as well. In all these pages, our handle is Synlab NG. Please do like, share, and follow. All right, continue with the question. Kelly says, is Hepantivir safe for HBV treatment? Did you get the question?
I got it. I'm just trying not to call names of drugs as much as possible because I realize this is, this is a public information education platform. So it's not a strictly medical platform. I don't want to run any drug down or promote any medication, but I think, I don't know if there's a way that we can contact each other off mic, because there are some of those drugs that are not specifically antivirals. They're likely just hepatotonic, like a liver tonic. So some are not able to reduce the virus by in the way that they are like marketed. So I'll just leave it at that, please. Thank you.
Okay, thank you, Ma. Shidali is asking that an individual who is a professional, say a pharmacist, will it be considered self-medication if the person discovers that they have malaria and they go ahead to take anti-malarials?
If this person is a pharmacist, I'm sure he knows the answer. So, how do you define self-medication? So yes, it's self-medication, all right? It's self-medication. The only time it's not self-medication is if you run a test and it shows that and somebody else prescribes for you. But if you're the one prescribing for yourself, we all do it. It doesn't make it right, but it's self-medication. We just don't want that to be a habit. So self-medication is defined as use of any medication on one's own initiative to treat self-diagnosed symptoms. Do you understand? So if you feel, I take that too. I feel I have symptoms of malaria. I understand these are symptoms of malaria. I get a combination for malaria. I've self-medicated. So yes, that's self-medication.
Okay, so there's a question here on that is specific to a particular drug. So I will take a cue from your previous answer and I would skip that question because it is specific to a drug. And then someone else asks, for someone that has fatty liver, what will she be taking for the fatty liver to go away? And what will she be avoiding? It's like this.
I think we answered that indirectly.
Yes, I think, yes,
Yeah,
that's what I'm going to say. That is pretty much. Okay, so for time, so that others can benefit. Somebody else asks, what about the role of sex enhancement drugs and energy drinks, which is very rampant in our society today? The person is asking what their role is on liver disease.
They actually also induce liver toxicity. So we have to be very careful. Performance enhancers, you have to be very careful. They give similar effects similar to what alcohol would do. So it's important that we're very cautious. I would advise that, if you're not sure of anything, run some tests, check your background of your liver before you start piling medications into the body. And also make sure, if you go to see a doctor before you take all these medications, that would also help. So it's important to be very careful before using all these medications. And that goes to even the illicit, marijuana, cocaine, heroin, all these different ones that are available. They even have direct effects. So some other drugs, the effect is not so direct, but some of these other psychedelic drugs, they have direct effects on the liver and they cause direct liver toxicity. So they are best avoided.
Okay, thank you again. Olaleye says, is there a difference between fatty liver and enlarged liver?
It's just the way it's said. Thank you, Olale. So fatty liver just means there's fat accumulation in the liver more than expected. We expect a little bit of fat in the liver, maybe less than 10%. But once you have 10% and above, we say, oh, there's fat accumulation. That's fatty liver. Liver enlargement means liver has gotten bigger than it should be. So there's a standard size of the liver. Once you go past that, they'll say liver enlargement. But we know that sometimes the fat accumulation could be what is responsible, but there are several other causes of liver enlargement. So sometimes you can have fatty liver without being enlarged, but sometimes you can have fatty liver and there's enlargement. But there are other things that can cause liver to enlarge. The liver can enlarge either like a reaction. Sometimes if you have infection, the liver can enlarge and it's still fine. The liver can enlarge because it harbors things like masses or tumor or fluid. Some people have what we call hepatic cysts and the liver is enlarged. Liver can enlarge if it has like abscess, you have liver abscess, so those are things that can also cause liver enlargement that is not linked to fatty liver. So they're not the same.
Okay. All right. So someone asked, I don't know if this, well, you would let me know if you would answer it. Said, what are the ultrasonographic features of acetaminophen-induced acute liver injury? Also, is acute liver injury reversible?
So I'll start with the second one. Acute liver injury, most times reversible if it has not resulted into like a failure. There's a liver failure that could be life-threatening. So if it's just acute liver injury from medication, the good thing with the liver, like we've talked about, is its ability to regenerate itself. So if you discover that you have liver injury and you notice that maybe you ran some tests and it showed the enzymes are high or the liver function is impaired, and you discontinue, that on itself, and rest the liver, avoid all the things. I mean, if you take alcohol, stop. If it was due to medication, stop it. If you've taken some other herbs that you're not sure of what it is, just discontinue, which is what we do. Once we suspect drug-induced liver injury, all drugs stop. We just say, just rest, eat well, eat healthy, take it easy, and things like that. Rest, is very, very important. So, sorry, what's the first part of the question again? So the other question was, what are the ultrasonographic findings of ultrasonographic findings of what, please? Okay, so I don't know if that answers the question. I think the host has gone off. There's so many other questions here that, let me see. So somebody was asking how much painkiller is too much. Honestly, I think it depends on so many things. For some medications, it depends on even the individual. Some are not able to tolerate as much as others. So the best thing is to stick to the standard dose, do not overdo. And if you have to be on medication consistently, you have to check the liver and please visit your doctor to be sure. Somebody asked, what percentage of alcohol is good for the liver? The answer is none. There is no good percentage of alcohol for the liver, please. So he's asking, why do pharmaceutical drugs contain alcohol? Well, I guess I wouldn't be able to answer this about drugs containing alcohol, but we usually advise that there's no good level of alcohol. Is it ever possible to contact our speaker? Okay, that would not be. Okay, so someone asked, Dr. Oyeleke, please, when you said there are medications used for managing hepatitis, what are these drugs? The drugs are antiviral medications, but I don't know to what extent I should be discussing those drugs here. They are antiviral medications. I can mention a name, tenofovir, for example, but you can't just go buy it. I mean, that is also partly what we're discussing. So you need to see your doctor. If you have hepatitis B, see a hepatologist, and they are available in all the big government hospitals around Lagos, in almost all the states of the Federation, please. So it's important to meet with your doctor and let them prescribe. We do not use medications for everyone. Some people would never require medication for hepatitis B. There are some tests you need to do, and you run those tests to see if you fit into the people that will require medication or not.
Okay. Thank you very much, Dr. Oyeleke. Sorry, the network dropped me off earlier. But thank you very much for holding it down. Okay, so we take one final question, and I would like to direct this question to Dr. Omoyele. Abisola is asking, what other tests can be recommended for someone with hepatomegaly that measures between 16.5 and 17 centimeter persistently, but the person doesn't have hepatitis B or C, normal cholesterol level, no liver cirrhosis? The guess is that such individual has a large liver physiologically. Should this be believed? Dr. Moyle, I don't know if you got that question.
Yes. Hello, Kelechi. Yes, I did.
Okay.
So for someone with persistent hepatomegaly, I would advise see a physician, a gastroenterologist for management, because it's possible the tests that have been done have not been able to identify the cause of the enlarged liver. For the enlargement, which should be identified. So I'd advise you see the specialist for proper diagnosis.
Okay, thank you very much, Dr. Moyle. For those who are, I can see some people in the chat asking for recording. Yes, you can always watch this on YouTube. And again, remember, our social media platforms is synlab.ng, present in Facebook, Instagram, Twitter, LinkedIn, and TikTok. Please do well to like, follow, and share, and also subscribe to our YouTube channel. Again, if you've not taken the poll that is ongoing, please feel free to do so, even as we come to the end of this program. So again, I want to thank everyone for attending. I thank our speakers especially. It's been a wonderful presentation from you, Dr. Oyeleke and Dr. Omoyele. Thank you very much for your wonderful presentation. And thank you again to our participants as well. Thank you for all the questions and thank you for your attendance. We urge you to subscribe to our YouTube channel and follow us on social media. And for those who still have questions that have not been answered, please, you can respond to the email you received following this registration. And as much as possible, the questions will be answered. So in the absence of anything else, thank you once again and do enjoy the rest of your evening.
Bye.
Bye.
Bye-bye.
Bye, everyone.
Every question